Good evening, live from ZTN studios in Harare, Zimbabwe. Welcome to The Chase, Zimbabwe's premier current affairs program. Our virtual discussion this evening, part 2 of Zimbabwe's COVID-19 vaccination rollout. Is it working? Hello, I'm your host, Andy Hodges. This broadcast is brought to you by Zimpaper's TV network, ZTN, and our partner, Lancet Laboratories. Now, to our millions of viewers joining online throughout Africa, Europe, America, the Middle East, and Asia, we would like to hear from you, and we will endeavor to ask your questions directly to our panelists later in the program. Join this discussion on our Twitter handle at ZTN News and on Facebook page, Zimpaper's TV network. So please make sure we hear your voice. Joining us virtually this evening to discuss part 2 of Zimbabwe's COVID-19 vaccination rollout, is it working, are Dr. Maxwell Mareza Hove, Chief Director, Curative Services at Zimbabwe's Ministry of Health and Child Care, Dr. Francis Chiwora, President of the Zimbabwe Medical Association, ZIMA, Enoch Dongo, Zimbabwe Nurses Association President, Itai Rusike, Executive Director at Community Working Group on Health, CWGH, and Phyllis Kachere, the Herald's Deputy News Editor, Convergence.
Vaccine program on Thursday last week, with health workers getting the first of 200,000 Sinopharm vaccines donated by China. Officials applauded Zimbabwe's Vice President, Constantino Chiwenga, after he received his vaccine. Zimbabwe's free and voluntary vaccination program aims to reach 10 million citizens and achieve herd immunity. Vice President Chiwenga urged Zimbabweans to have confidence in the vaccines, saying his ministry conducted all scientific processes to ascertain the efficacy of the Sinopharm vaccine, which is confirmed to be 79%. China yesterday pledged to donate an additional 200,000 doses of the vaccine, bringing its total donation to 400,000 doses, with another 600,000 doses bought commercially from Sinopharm expected within a week or two. The country is also set to benefit from the African Union Global Fund COVAX facility soon, while Russia has also pledged to work with the country in securing the critical inoculations.
Now, in the studio with me this evening is Phyllis Kachere. She is the Herald's Deputy News Editor, Convergence. And there's a reason why we brought her on The Chase, because Phyllis, you have already received the vaccine. You're one of the few, or one of the frontline workers that has done it. Can you describe your experience and the process when you took it? Was it simple and straightforward?
Thank you, Andy. It was one of the simplest things that I have ever done. When I got to Wilkins Hospital, where I got the vaccine, we had to wait a bit because of logistical challenges, but the wait was worth it. I think we waited for about an hour or so, but the process from the moment the nurse who inoculated me explained how she was going to do it to the whole process, I think it took less than 2 minutes.
2 minutes?
2 minutes.
So it's that simple?
It was as simple as ABC.
Oh, wow, okay. Well, I still have to get mine, so that's good to know. And all of you out there who are going to get the vaccine, please hear what Phyllis has said. It is that simple. It isn't complicated. Itai, let me come to you. The government has been clear that the vaccination will be on a voluntary basis. And I quote the president of Zimbabwe, who said, "The vaccination will be done for free. Private entities and organizations who want to procure the vaccines for their staff or members must be prepared to distribute for free. Government will not allow any form of profiteering from the vaccination program." It was, however, reported that Zimbabwe may consider mandatory inoculation against COVID-19 following resistance from some sections of the population. However, human rights doctors said the government risks contravening Section 52 of the Constitution on health rights if it orders compulsory vaccination. What is your comment on that, Itai?
Yes, I feel that, vaccination should be done voluntarily, and, the public should show willingness to go and get vaccinated. And I'm happy to also say that, Zimbabwe, we've got one of the most progressive, public health act. So in terms of our public health, approaches, it is important that we are also guided by the provisions of the Public Health Act. Unfortunately, the current Public Health Act does not have a provision, for mandatory vaccination, except for children and those people with the, say, mental challenges. So what it means is that if there are to be any moves towards mandatory vaccinations, it means the Minister of Health has to consult widely, especially with the Minister of Labor, in terms of then coming up with a statutory instrument that can allow for mandatory vaccination. In fact, we don't really need mandatory vaccinations. What is needed right now is for us to package our information and education and awareness activities and convince the general public on the importance of vaccination. We are all aware that vaccines save lives. We were all vaccinated when we were kids, and up to now, our children are still being vaccinated against, the diseases. So vaccinations are good for the population, but there's no need to, initiate mandatory vaccinations. What we need is to persuade the general public by also telling them, the importance of getting vaccinated.
I expect Dr. Maxwell Mareza Hove. He is the Chief Director, Curative Services, Ministry of Health and Child Care, but unfortunately he's unable to make it this evening. Francis Chiwora, President of the Zimbabwe Medical Association, you heard Itai's comments there, so let me ask you straight, mandatory or free, your comment?
Good evening, everybody. It's very clear. I think his comments are quite correct. Vaccination, particularly of the COVID, because this is a pandemic and emergency, it should really be free. It should not be mandatory. What is required now is, as he correctly pointed out, is information to the public. People should know, to be informed what the benefits are, what the risks are. Even when we started vaccinating the health care professionals, I have been vaccinated. There was quite a lot of reluctance to take the vaccine from the professionals at the beginning because they were not aware, they were not sure what the benefits are. But now, as we explained even to my colleagues and everybody, the uptake increased so much so that, in fact, the centers were overwhelmed. It should really be free. We need to explain to the population that the benefits. So free vaccination, not mandatory, is recommended.
Enoch, you heard there what Francis said about the uptake, but you were quoted as saying that the general assessment showed that there was a low uptake of the vaccine among nurses throughout the country. You said health workers lacked the necessary information. I think both Francis and Itai have said that. Is this still the case? What is the real situation on the ground? Enoch? Okay.
Hello.
Oh, hi, Enoch. Did you heard my question, I hope?
No, can you repeat it?
Sure, sure, mate. Sure, no worries. Both Francis and Itai stated that there seemed to be an uptick in people taking the vaccine, but you were quoted as saying that a general assessment showed that there was a very low uptake of the vaccine amongst nurses throughout the country. You said health workers lacked the necessary information. Is this still the case? What is the real situation on the ground?
Thank you very much. Good evening, Zimbabwe. Yes, I still stand with the statement that I made before. As the president of the Zimbabwe Nurses Association, but most importantly, as also the team leader of the Apex Council, which is the council that represents all health workers in Zimbabwe. I can only speak on behalf of the health workers. This is because the first rollout had a particular target, and the health workers were most of those who were targeted for vaccination under the first rollout. So in our view, in order to assess that success of this vaccine rollout, an important question has to be asked. What is the percentage of the health workers who have been vaccinated so far versus those who should have been vaccinated? Having asked that question, whilst we are still collecting actual the numbers, indication from health workers and our affiliates partners at Apex Council, as health workers, we have been those who have been vaccinated so far. Everything being equal, we should actually be hearing that government is struggling and is overwhelmed to contain the numbers of health workers who want to be vaccinated on a daily basis. But that is not the case right now as we speak. This is because ordinarily be expected that health workers should know exactly what they are getting themselves into. So I agree with Itai Rusike, what he said, that there is need for information. The reason why there has been such a low uptake of vaccination by health workers is because of trust deficit between government and the workers. This trust deficit is not because health workers do not trust their government, but it is because the vaccination program itself has not been properly explained to them. Government actually forgets that health workers are still ordinary citizens, and therefore they need to trust a process before they take it. Just because they are health workers does not automatically mean they understand what the vaccination program meant to achieve, but rather they should have be educated just before every citizen has to be. But, so
that's the situation on the ground. Enoch, that's a good point. But Itai, you were quoted as saying that misinformation could hinder the vaccination program. Can you please expand on this? And what should be done to get the truth out there? Furthermore, from a civil society perspective, what is your take on Zimbabwe's vaccination rollout to date?
Yes. In fact, what we are seeing on the ground is that there's a gap, in terms of credible information, especially coming from the Ministry of Health side. So because of that gap in credible information, what we are now seeing is that there's now an element of, mistrust and general lack of confidence, especially in particular to this Sinopharm, vaccine. It doesn't really mean that Zimbabweans do not want to get vaccinated, not at all. Because even right now, in the middle of this pandemic, you would realize that mothers are still willing to get their children vaccinated. But I think it borders on the issue of how this Sinopharm vaccine was, procured. Even the ones that were donated. I think the whole process from the beginning should have been a lot more clearer. The government should have, done a little bit more to inform the general public. Why is it that as Zimbabwe, we are opting, to get this Sinopharm vaccine, even though there are other vaccines? And if that information had been made very clear from the beginning, I'm sure the issue of misinformation, disinformation, science denialism, and vaccine hesitance that we are now seeing could not have, a reason. But because people are lacking information from credible sources, they are now depending so much on other, information sources, especially the social media and from their peers. And as a result, there's a lot of disinformation, that is happening right now. And our appeal to the government is that let us learn something from the, early days of HIV and AIDS, whereby there was a lot of information out there. on HIV and AIDS, to the extent that no matter where you would go, you would find there was literature, billboards on radio, on television, a lot of information about HIV. So as a result, people were made aware of what HIV was all about. But when it comes to this Sinopharm vaccine, I think the reason why the suspicion is not because people don't trust vaccines. I think it's because of the lack of transparency, especially at the beginning, in terms of sharing the information to the public. This information also needs to be packaged, in relevant forms. Right now, most of the information that you see, it's either in English or Shona or Ndebele. But let us also appreciate that we have got so many other minority languages. If you go to Binga, they mostly speak Tonga. But is there any information on, COVID-19 vaccine, in Tonga? The same with Wange, they speak Nambia. You go to Plumtree, they speak Kalanga. You go to Manicaland, they speak in Dao. So our information packaging, I think, needs to improve, and hence we can demystify this disinformation, misinformation, and sadly, the vaccine hesitance that we are seeing now. Unfortunately, it's not just coming from the general public. We are now even seeing it within the health professionals. Look at the numbers that have been vaccinated so far. And as the country, we were targeting at least 100,000, people for this phase one. And I see a challenge for us to reach even that 100,000 figure. And then what happens when we go for the national rollout? It will be a challenge, for Zimbabwe, to reach herd, immunity. And we are saying we need to vaccinate at least 10 million Zimbabweans.
I want to bring Enoch in here, because Enoch, critics have stated, and I want to quote this. They said, government does not want to engage workers' representatives who play an important role in positive influence on policy implementation. Furthermore, health workers were only trained on how to administer the drug when it was already in the country. Is this criticism justified in your opinion? Enoch?
Yes, hello.
Hi, mate.
Yes.
Please go ahead.
Yes, hello. How are you?
I'm good. Did you hear the question, Enoch?
Yes, I get it. No, yeah, that is very, very, very justified. It's really true. It's unfortunately that Minister of Health has decided to go it alone at administrative level, and they have not engaged the frontline health workers. Just to give an example, an ordinary nurse in any of our hospitals has more engagement with patients on a daily basis than, for example, Dr. Hove or somebody or someone who works in an office at Ministry of Health. If that ordinary nurse has not been educated, he also cannot educate patients on the importance of being vaccinated. Actually, he may end up discouraging people to be vaccinated due to ignorance. So more resources should be channeled towards frontline health workers in terms of their education, because we are seeing a change. Mr. Rusike was said, we are still not there, and we are going to have a problem to convince the district, provincial, or central hospitals. And when they approach those nurses, they want correct, authentic, correct. Those who are supposed to have the information, they don't have the information. call all stakeholders, all relevant stakeholders, as far as this COVID-19 program of vaccination, and then
In the Chase, Zimbabwe's current affairs, premier current affairs program. Our virtual discussion this evening, part 2 of laboratories. Remember, we would like to hear from you, and we'll endeavour to ask your questions to our panelists. Your voice. Francis, some concerns have been raised even by parliamentarians on this. It's alleged that unless the vaccine doses are brought in quicker, enough to vaccinate 10 million people, which is the government's target, then herd immunity of 60% of our population will not be reached. Your comment on that?
Yes, thank you very much. Yes, it is very important to bring the vaccine two doses which are spaced between 3 and 4 weeks. So we need to have enough vaccinated all the time to give the first dose and the second dose for those that will be due. So that, I think that is a very important aspect of the program. It has to be, done in a very proper and accurate way.
Thank you. We had invited Dr. Maxwell Mareza-Hove. He's Chief Director, Curative Services at Zimbabwe's Ministry of Health and Child Care, because, of course, we wanted to get the government's update on how the vaccination rollout is progressing. However, he's unfortunately unable to make it. Back to the studio here, Phyllis. You're in the media, of course. You work here at the Herald, one of our sister publications, and of course part of the Zim Papers group. And being in the media, have you heard of any resistance to taking the vaccine? Do you know of any common reasons why some people may be wary of taking it?
Thank you, Andy. One thing that I've noticed is there's been a lot of misinformation, fake news. It has dominated the vaccination program. And it hasn't been fake news from within the borders of Zimbabwe, internationally. I'll tell you a little story. Soon after I got vaccinated last week, I met a couple of senior frontline workers that I expected to be willing to get vaccinated. We had a casual conversation, and they told me, if this is not going to be mandatory, they will wait a little longer. They will not be vaccinated. And I was like, why? Because I was feeling upbeat about my vaccination. And I was surprised. And they were like, no, we can't. Why? Where are the fears coming from? They said, we've been reading a lot of news from social media. And clearly that's fake news. And clearly there hasn't been a counter to the fake news. Most of the times, people are inclined to the negative fake news. They will listen to it and they will keep forwarding it. So much that when there is a chance for those in communication to counter that, their pleas fall on deaf ears, because the first word is those fake conspiracy theories that are moving around. So what I would think is for the communications around vaccination, there has to be a robust communication strategy that counters fake news.
Yeah, I mean, let the news be about the truth of the vaccine, with warts and all, so that people understand exactly what they're going to be taking, rather than listening to social media, which is the common trend at the moment. Again, from your experience, did you find the frontline staff who vaccinated you, were they fully trained and able to explain all the issues to you concerning the vaccine?
The ones that vaccinated me, I found them very conversant with the issues around the vaccines, because myself and my colleague Costa, we took some time asking questions around it. The sister in charge, who was in charge of the place where I got vaccinated, answered quite convincingly that I felt very convinced and I felt very safe to take the vaccine. Although initially I also had those fears, I also had those questions, but after the explanations, I felt upbeat about it.
Well, that's good to know. At least the frontline staff who you met gave you a full explanation. Itai, you know, I believe all of you have been talking about information gap, let's call it that, in terms of the truth and fake news or all the rumors that are circulating on social media. But can CSOs play a role in educating and communicating with citizens about the vaccine, so to be able to boost the uptake in numbers? And if so, how can they do this?
Yes, I think, you know, what VP Chiwenga did when he was the first person to get the jab, it showed, you know, a lot of leadership. And what we really need is we want champions. We want ambassadors, especially from the national leadership, to take the lead. You know, it gives the ordinary person a lot of confidence when you see your leadership also being vaccinated, and especially being the first, you know, to get vaccinated. You know, similarly, I took my jab last week on Thursday at Wilkins Hospital, and as soon after that, I posted my photo, you know, on the various, you know, civil society platforms. It generated a lot of interest, you know, from civil society. And some members were openly saying, if Itai can be vaccinated, it shows that, you know, he also has confidence in this vaccine. And I saw a lot of my colleagues also going out there, you know, to get vaccinated. Because in the NGO sector, we are also frontline health workers, because we work with communities every day. So it is also important that we are also vaccinated and protected, you know, from COVID-19. But like I said earlier on, the issue of COVID-19, especially awareness and information sharing, is not just the responsibility of the health sector. You know, civil society, NGOs, we all have a role to play. The churches, they all have a role to play. Traditional leaders and the media, we all have a role to play in terms of, you know, educating communities about the importance, you know, of being vaccinated. But I think most importantly, the Ministry of Health should take the lead and partner with all these various, you know, health stakeholders to make sure that the people out there, they get, you know, the correct information. The people out there, they don't end up relying on social media platforms. Unfortunately, like what the sister in the studio said, they end up getting, you know, fake news, fake information, fake news, and so forth. But I think it's important that we package our information. And like I said earlier on, let us also learn from the HIV era, the early days of HIV, when there was so much information out there, and let's do the same with this, you know, COVID-19 vaccine, so that we can get a lot more people, you know, willing to get tested.
Francis, Itai Rusike, of course, is on our show. I'm going to tell you a quote that he said, and I don't want to ask him yet. I'd like to ask you. He said, what the government of Zimbabwe should do is to provide the frontline health workers and the people of Zimbabwe the options to choose the vaccine brands of their choice, instead of foisting the Chinese Sinopharm vaccine to everyone. What would be your comment to Itai's quote there? Francis? Hello, Francis, are you still with us?
Sorry, I unmuted myself. Yes, thank you very much, Andy, for that question. You know, a vaccination program is not is a major program. Any nation that's going to do a vaccination is to recognize that they're taking a major undertaking. There's no doubt that one would have wanted to see a lot more consultation, particularly with the health stakeholders, about which vaccine to bring in the country. I'll give you a typical example. I'm in a group with various medical associations throughout Africa, and in those countries, many countries, the doctors were actually involved. The associations were asked which various vaccine do you think is the best. They even asked me which vaccine have you recommended to your government. We never got a chance to recommend any vaccine to our government. Nevertheless, that has happened. And we have got the vaccine that we have got here. It is effective. It is not as effective as others that are there, but it is quite effective. For a nation, from individuals or groups of individuals to then choose which vaccine they want to have, it brings a bit of complexity and problems in terms of vaccination program for a nation. You need this to be a standard for the whole nation. So that when you control the pandemic, or if you fail to control the pandemic, you can then see what is the problem. If you have got X, Y, Z, Chinoi saying having this vaccine and that one vaccine, and then your program fails, it will be very difficult to identify which one is a failing or which one is succeeding. I think it's mandatory that we have a uniform vaccine for all the national. Mistakes may have been made in terms of deciding which one we should take. I believe, certainly I agree with the Itai and that there should have been more consultation, but in this case it didn't happen. And I think one of the most important aspect that has been highlighted is the issue of information. I will tell you that by the day before we rolled out, I just didn't have enough information. I later on got information which we then circulated to our members and which made people understand. And this, I must admit, this information did not come through the national channels, but from various members of our association who got the information about the vaccine from various sources, medical sources, medical journals, and so on. So yes, I think we should accept the vaccine that is there. And not have individuals seeking different types of vaccine. That will cause a major problem.
Right, Itai, the quote was attributed to you, and just to repeat, you said that people of Zimbabwe should be given the option to choose the vaccine brands of their choice instead of foisting the Chinese Sinopharm vaccine on everyone. What was your reasoning? If you could briefly explain what your reasoning was behind that statement.
What I meant was it was important to have a people's vaccine, whereby the people of Zimbabwe can embrace a vaccine, because as key stakeholders they would have been consulted in one way or another. We are all realizing that. The decision was, top down. There was very little, stakeholder consultation in terms of the vaccine that could easily be embraced, by the general public. So what we are now seeing is that there's an element of, like xenophobic, approach to this Sinopharm, vaccine. Like I said earlier on, doesn't necessarily mean that Zimbabweans don't want to be vaccinated, but they've got a lot of concerns with this, Sinopharm vaccine. Even though personally I was vaccinated because I had no choice, and because this is the only vaccine that is available right now in the country. But I was not saying that people should be given a supermarket approach where they can choose to say, I want to be vaccinated by this and I don't like the other one. But I think it's important that as a country with a very progressive constitution, we must always, get inputs and views, from the people. Because like what we are seeing right now, there's a lot of resistance, concerning this Sinopharm vaccine. And it's also coming as a result of, the lack of, participation in the whole process right from the beginning. So I think authorities have learned something, that in future, such important, national programs, they should involve, the stakeholders and the general public, because at the end of the day, it's important to put people, at the center of this, COVID-19 response, rather than for the authorities to think they can just make decisions without, getting, inputs from the general public.
We had invited Dr. Maxwell Mareza Hove, he's Chief Director Curative Services at Zimbabwe's Ministry of Health and Child Care, to appear on the Chase this evening. Unfortunately, he was unable to make it, but we would hope to get the government's position, and particularly in terms of the progress on the rollout and some of the questions I'm asking my other guests. You are watching The Chase, our virtual discussion this evening, part 2 of Zimbabwe's COVID-19 vaccination rollout. Is it working? This broadcast is brought to you by Zim Papers TV network, ZTN, and our partner, Lancet Laboratories. Remember, we would like to hear from you, so please join in this discussion through our Twitter handle at ZTN News and via our Facebook page, Zim Papers TV network. Enoch, you mentioned something earlier, and so did my other guests, and I'd like to put the question directly to you. Are your members sufficiently trained, and do they have the required knowledge to effectively vaccinate 10 million Zimbabweans? In your opinion, is there anything missing or can be improved upon?
Yes, thank you very much. Yeah, there is need for collective engagement by the Ministry of Health Administration. Right now, as we speak, we have seen individualism as far as the issue of the vaccine is concerned. You cannot decide for the people. You cannot just decide for the masses. They need to involve everyone. This issue has to be addressed right now as we speak. Most of our members across the country, they lack information. They lack correct information about the vaccine. And the moment that they don't have the correct information, we have only few nurses who have been trained, who have been given adequate information, considering the work that we heard, the work that is in front of us to vaccinate 10 million people. It's not enough. And the way the Minister of Health is administering this program, we are totally against the administration part of it. We need the ministry to involve all the stakeholders that are matter most as far as this vaccine issue is concerned. We talk of 6.7 million that was allocated towards, and look at the amount, 9-point-something million towards training. It's not enough. It's not enough at all to train enough health workers for them to be able to disseminate correct information to the public. You have seen that right now as we speak. The dominant information is misleading information which cannot be verified. The correct information is not there. So we are saying to the Ministry of Health, we are an important stakeholder, the health workers. We are the health workers representatives. We need to get to have the correct information so that we can go out together as a unit and give confidence to the health workers first, so that they can disseminate it to the ordinary Zimbabweans.
Thank you. I will say, though, that Dr. Maxwell Mareza Hove from the Ministry of Health and Child Care, he did intend to appear on the show, but unfortunately circumstances beyond his control, he was unable to make it. But we will endeavour, of course, to get the government's official position in future programming here on ZTN. Francis, the issue of adverse side effects is very topical among Zimbabweans. And I think a lot, as we've been saying in the show, a lot of these side effects have been spread out on social media. What have you actually heard? Have you received any reports on this? I know the cabinet briefing from Tuesday stated that there'd only been one report of a mild rash, but what have you heard?
Thank you, Andy. I've not heard a single case of adverse side effects or reactions to the vaccine. I have had the vaccine myself, my wife, and a lot of colleagues that I work with. None of them has reported any adverse side effects. It's not even painful getting it, but obviously we haven't heard from the rest of the country. There could be others, but so far I've not heard any.
Okay, well, that's good news. I mean, let me come to Phyllis. I mean, Phyllis, as we said, you're here because you took the vaccine. Of course, one of my co-workers. Side effects? Nothing?
Nothing so far. And like what you said, it's not even painful. Before you know it, they are done.
So Zimbabweans shouldn't be concerned. They should go get the vaccination. They should ignore fake news and try and get the real information. They should search real information and not be concerned or about side effects, or at least the evidence at the moment from the reports about side effects.
For now, I haven't heard or read like what you said. There's no negative report so far. So I don't see why we should wait any longer to take the vaccine.
Enoch, I want to both ask you and Itai, just very briefly, of course, because this is a critical issue about the alleged side effects, particularly of the Sinopharm vaccine. Do you believe Zimbabweans should be concerned about the alleged side effects that are being reported, particularly on social media?
I don't blame the Zimbabweans that are having misleading information about the side effects. What I want government to do is to give the correct information. Right now, as we speak, yes, we haven't received information about anyone who have reacted after getting the vaccination, which is a good thing. But that has to come out from the government itself as an authentic, as a correct information to the people, so that people can have confidence in the vaccine and we move on. We totally believe, we totally agree that vaccination is the way to go as far as the COVID-19 is concerned.
Thank you. You're watching The Chase this evening. Our virtual discussion, part 2 of Zimbabwe's COVID-19 vaccination rollout. Is it working? This broadcast is brought to you by ZimPaper's TB network, ZTN, and our partner, Lancet Laboratories. It's now the time that we hopefully will ask some of your questions directly to our guests, questions we received via our Facebook page, ZimPaper's TB network, or via our Twitter handle @ZTN News, and our other media platforms. Thank you very much for some of the questions which I have here. Itai, I want to come to you because there's been a lot said about COVAX, and thank you very much for this question from one of our viewers. It says the program is planning to deliver about 2 billion vaccine doses globally by the end of the year. And so the question is that who is behind the COVAX scheme, and will Zimbabwe benefit from it? Do you have any information on that?
What I know about the COVAX facility is that it is being spearheaded by the WHO, and it supports a country with about 20% of your national requirements, meaning that we cannot also depend wholly, on the COVAX facility because it only covers about 20%. I think so far only Ghana has received their.
Okay, we appear to be having sound problems. Itai, are you still there? Okay, we'll continue with one of the questions again on COVAX, and it's interesting that Itai there mentioned Ghana, because the question is, one of the first COVAX doses only started arriving in Ghana a week ago, Ghana being one of the first African countries to benefit from the scheme. And of course, critics have forecast that most African countries will be buying the vaccine at a higher price than their Western counterparts, partly because they didn't pre-order. Furthermore, COVAX has so far raised $6 billion, but said it needs at least another $2 billion to meet its target for 2021. COVAX, of course, will not meet the full needs of a country like Zimbabwe, and so there will be a substantial funding requirement to procure all of the remaining doses required. Francis, you heard that question. The fact is there is a funding gap, and as much as COVAX may assist poorer nations or developing nations to procure some vaccination, there will be quite a substantial gap between what's provided and what's required. So your comment on that, because we need to balance our economy and the buying and funding of getting the vaccinations. Your comment.
Yes, thank you very much, Andy, for that question. Obviously, given the importance of vaccination and fighting the pandemic, we need to find the resources within our own economy, the treasury, so that we can meet the gap of from the Govt facility. We simply have to find the money for that. This treasury and government has to do that. It's mandatory that we should, because it's a public health emergency.
There's no way else, isn't it? I mean, the vaccination is there. It needs to be taken. And unfortunately, however much you try and dodge it, it's a fact. Vaccination needs to be taken, particularly if we want to achieve 60%, which is, of course, the herd immunity percentage, so that at least we don't then continue spreading the virus amongst ourselves. Enoch, you know, as a representative of the Nurses Association, our viewers have asked this question. In fact, there's a lot of questions about this on our social media platforms. And the question, of course, is the vaccine meant for children? What is the age limit? What is the gap? Who should take it? You know, people with young kids, should they think, let's go take our children to get vaccinated? Enoch?
Thank you very much. I don't want to speculate as far as that question is concerned. Specifically, I cannot answer that. I think I can refer to the next panelist who is present right now.
Okay, sure. Let me open that up. Francis or Itai, maybe Francis, do you have any feedback or any information on the age limit or age requirement to take the Sinopharm vaccine in particular? We're hearing different rumors. It could be 20 years old, it could be 18, it could be younger. Are you hearing anything?
Yes, there are very specific age limits at the moment. The under fives may not get this vaccine. Those women who are breastfeeding, women who are pregnant, and women who are intending to get pregnant may not get this vaccine. The information that is there so far, in fact, is for most vaccines, is not enough to declare safety for use of this vaccine on those groups. And the people who are very severely immunosuppressed may not take those drugs. So it's the very small children may not, under 5 years, may not take the vaccine. Information is being gathered as to whether or not these vaccines, and this goes mostly for all the other vaccines. In due course, it may be possible to vaccinate even these groups. I was reading even today that there has been vaccination in America of pregnant women, but it's a different vaccine. And I think up to about 5,000 have been vaccinated, and there's not been any adverse effect. So information is coming up every day, every minute. We may, by the end of the year, be able to vaccinate those groups that were excluded at this moment. It's just that there's not enough information for us to include those groups.
Itai, what about Zimbabwean citizens who suffer from what we term underlying conditions? Do you think that they should be concerned about taking the vaccination? Do you think that those underlying conditions could put them more at risk?
I don't think so. I think in terms of the priority list that has been drawn out, you would realize that after the frontline health workers, they are talking of people with existing health conditions, and these are people who may be, living with some chronic conditions. So I'm not a medical doctor, so I said is that people with existing health conditions will be next during the second phase.
It's unfortunate because this is such an important discussion because it does affect 14 million people, which is pretty much the entire population of Zimbabwe in terms of vaccination and taking the vaccination. And we are coming to the end of the show. However, we will be continuing this vital discussion here on Zimpaper's TV network, ZTN. So let me get some final comments from each of you, starting with you, Phyllis. Your final comment. Would you encourage Zimbabwean citizens to take the vaccine? Speaking, as if I can call you, as a Zimbabwean citizen.
I would definitely encourage all to take up the vaccine, but I would also insist on let's get our communications right. Let's get the good word out there. Let's not wait for the fake news to flood the market.
And let's not be scared, I would assume, because it's about fear, isn't it?
There's nothing to be scared
because
about.
Those rumors and fake news are stoking fear in citizens, and that's wrong, to be clear.
Very wrong.
All right, let me go through all my guests today. Let me start with you, Enoch. Any final comments, particularly on advice to the government on how going forward, because this is phase one, and obviously the majority of the population hasn't yet entered the vaccination program. What advice would you give to the government on how to make the vaccination program a success?
Thank you very much. There is need for government to engage the health workers. There is need for government to make sure they involve all stakeholders as far as the vaccine is concerned. There is no individualism supposed to be accepted. We need government to provide correct information to dominate the social media rather than what is happening right now, where the fake information is dominating the social media, and this is actually convinced the citizens. So we need involvement of everyone. We need correct information from the ministry to be out there so that we gain confidence of the health workers first, then they can disseminate in their numbers to the citizens of Zimbabwe.
Thank you. I would hope that this program here on The Chase is a step towards getting some of that communication out to the citizens of Zimbabwe. Itai, your final words and any advice or any comments on how to make the vaccination succeed, or at least improve in terms of its take-up, because we are entering the next most critical stage where we get more of our citizens coming forward or encouraging them to come forward to take the vaccine. Itai?
Yes, I think it's important for the government to explain, to the general public of Zimbabwe why we settled for the Sinopharm vaccine, what are the advantages of this vaccine compared to the other vaccines, and the government should make sure that correct information goes out there to the general populace. Credible information is shared widely, to all the Zimbabweans. If we are to convince them to willingly, take this vaccine, and we need to make sure that this information is packaged, properly, and this information relates, to each and every Zimbabwean, so that we can increase the numbers of people to be vaccinated. But most importantly, when we start the national rollout, the government should also involve the traditional leadership. The government should also involve the elected leadership, the religious leadership, so that they can become our champions, so that they can become our ambassadors in encouraging their various constituencies to go and get vaccinated.
So, Itai, to be clear, you would encourage Zimbabwean citizens to come forward and take the vaccination voluntarily?
I got the vaccination, I got my jab, so I will not be selfish not to encourage others to also get protected from COVID-19. So yes, I will encourage Zimbabweans to go and get vaccinated. Since Thursday last week, I haven't experienced any side effects. So I really want to encourage Zimbabweans. This is the only option that we have. I don't see us getting any other vaccine, because I don't see that the government has got adequate resources to bring the other expensive, vaccines. So this is what is available. Please go and get vaccinated.
Thank you. Francis, your concluding remarks. Would you encourage Zimbabwean citizens to take the vaccine? Are there any suggestions that you would give the government on how to improve the vaccination rollout program?
Yes, and my final comment is that everybody should take this vaccine. It is far much better if you are facing a lion to be holding a no carry than to be only carrying your hands. You will not be able to fight. You will definitely die. So the vaccine is the only weapon that we have to fight this COVID-19 with. So I would encourage everybody, every one of us, to take up the vaccine. Ignore what is said in the social media. Yes, the government definitely needs, we need, and all of us, stakeholders, We need to reach out to the population to explain to them the need for the vaccination, to explain that it's completely safe. It's our best option for fighting this COVID. So information dissemination is so important in this fight against COVID. Thank you.
I like that. As a final comment, when you're facing a lion, make sure you're carrying a knob kerry and not just your hands, and you'll survive. We have come to the end of our show this evening. I'd like to thank our guests. That is Dr. Francis Chiwora, President of the Zimbabwe Medical Association, ZIMA, Enoch Dongo, Zimbabwe Nurses Association President, Itai Rusike, Executive Director at Community Working Group on Health, CWGH, and of course here in the studio, Phyllis Kachere, the Herald's Deputy News Editor at Convergence. And I would also like to point out that we had invited Dr. Maxwell Mareza Hove. He is Chief Director Curative Services at Zimbabwe's Ministry of Health and Child Care. Unfortunately, he was unable to make it. Thank you all for appearing on The Chase this evening. You've been watching our virtual discussion, part 2 of Zimbabwe's COVID-19 vaccination rollout. Is it working? This broadcast is brought to you by Zimpaper's TV network ZTN and our partner, Lancet Laboratories. Well, that's it for me this evening. I'm Andy Hodges. Have a great night. Enjoy your night. And you all be safe.